Understanding the link between lisinopril and elevated potassium levels. Lisinopril, a widely used angiotensin-converting enzyme (ACE) inhibitor, is prescribed for conditions such as hypertension and heart failure. While effective, it carries the risk of altering electrolyte balance, specifically increasing potassium levels in the blood. This condition, known as hyperkalemia, can be especially problematic in certain populations and under specific clinical circumstances. How lisinopril affects potassium in patients with kidney impairment. Numerous studies have shown that lisinopril can raise serum potassium levels, particularly in patients with compromised kidney function. One clinical comparison between lisinopril and valsartan, an angiotensin receptor blocker, demonstrated that individuals with a glomerular filtration rate, GFR, of less than or equal to 60 ml/min/1.73 m superscript 2 experienced more significant increases in potassium when treated with lisinopril. These findings highlight the heightened risk of hyperkalemia in patients with renal insufficiency who are prescribed ACE inhibitors. Comparing lisinopril to other antihypertensive agents. Research comparing lisinopril to other antihypertensive medications further supports its association with elevated potassium. In one study, patients taking lisinopril had a higher incidence of hyperkalemia than those treated with chlorthalidone or amlodipine. Another comparative trial involving high-risk individuals found that lisinopril was linked to a greater frequency of hyperkalemia than losartan, reinforcing concerns about its potassium-raising effects. The biological mechanism behind lisinopril-induced hyperkalemia. Lisinopril's impact on potassium levels is largely due to its inhibition of the renin-angiotensin-aldosterone system, RS. By reducing aldosterone secretion, lisinopril limits the kidney's ability to excrete potassium. As a result, serum potassium can accumulate, particularly in patients with reduced renal function. Studies examining metabolic changes during lisinopril therapy consistently report increases in serum potassium, underscoring this pharmacologic effect. The role of diet and drug interactions in potassium regulation. Dietary habits can further influence potassium levels in individuals taking lisinopril. Foods naturally high in potassium, such as bananas, oranges, and spinach, may increase the risk of hyperkalemia when combined with ACE inhibitor therapy. However, experimental studies involving hypertensive animal models suggest that the interaction between lisinopril and potassium-rich foods may depend on other individual health factors and may not always result in significant serum potassium elevations. Clinical implications and recommendations. In conclusion, there is a well-established association between lisinopril and high potassium levels, particularly in patients with pre-existing renal impairment or those consuming potassium-rich diets. Compared to other antihypertensive agents, lisinopril poses a relatively higher risk of hyperkalemia due to its direct effect on aldosterone production and potassium excretion. Healthcare providers should routinely monitor potassium levels in patients prescribed lisinopril, especially those at elevated risk. Patient education on diet and potential drug interactions is also essential to minimize adverse effects.